Welcome to the deep dive. Today we're tackling a really pivotal piece of the healthcare puzzle, how we talk about and implement quality improvement or QI initiatives.
Yeah, it sounds simple maybe, but it's often the make or break element.
It really is. So we're going to dig into why effective communication is, the bedrock of successful QI.
We'll look at where things commonly stumble, maybe share a useful framework.
To keep you on track,
Yeah,
definitely. And offer some, hopefully, very practical advice you can put into action right away.
exactly. And to get the full picture, we've pulled insights from quite a range of sources.
We have some really authoritative ones like global accreditation bodies, JCI, Joint Commission International.
Setting those international standards, NABH in India too.
Right, the National Accreditation Board for Hospitals and Healthcare Providers. We're also looking at expertise from consultancies like Supremediq.
They guide organizations through this stuff. And the global view from ISQA, the International Society for Quality in Healthcare.
Yeah, they focus on improving care worldwide. And some really practical wisdom from the QI Playbook podcast.
Love that one. And we're weaving all that together with just the fundamental principles of good communication during any kind of change.
So our mission for you today is pretty simple, really.
We want to make it crystal clear why communication isn't just like an add-on for QI implementation.
No, it's the foundation. Absolutely fundamental for success.
And we want to equip you to navigate those common challenges, give you that robust framework.
And tangible tips. So your QI efforts don't just launch, but actually, stick, take hold.
Okay, let's dive in then. Why is communication so incredibly important when we're trying to roll out these quality improvements in healthcare?
It seems obvious on one level, but the impact, it just ripples through everything, doesn't it?
It absolutely does. At its core, good communication just aligns everyone, gets them on the same page.
Right.
When the goals, the methods, when they're clear to all the team members, you just cut down so much confusion.
And in healthcare, which is already so complex, that clarity is just paramount.
Totally. And it's more than just knowing the steps, right? It's understanding the why.
Exactly, the what.
Keeping everyone looped in on the reasoning behind the improvement, how it fits the bigger picture, the organization's goals. That's crucial for preventing resistance.
People are much more likely to get behind something if they actually understand the purpose. Makes sense.
Precisely. And strong communication also makes accountability clear.
Okay, how so?
Well, when roles, responsibilities, timelines, who does what, by when, why, when that's all explicitly defined and communicated.
Ah, I see. It's much easier to track things, make sure tasks get done.
Yeah, effectively and on schedule. Plus, let's not forget the kind of softer side, morale, momentum.
Oh, that's a big one.
Good communication really fuels that. When people feel informed, feel part of the journey.
It builds that shared ownership, that sense of purpose, brings everyone along.
And, the QI Playbook podcast made a great point. Even a brilliant QI idea
Can totally flop if the communication around it is poor.
Exactly. It's the bridge between a good plan and actual real-world improvements in care.
And multiple sources back this up. You have to proactively tell everyone affected about new processes, how their work might change.
Nobody likes surprises like that, especially changes that affect your daily routine.
No kidding.
And involving stakeholders, getting them involved in the planning and the communication.
That builds buy-in, right? Ownership.
Vital buy-in and ownership, absolutely.
Right.
When people feel their views are actually heard and considered.
They're just much more likely to support the changes and help make them work.
It's about making them feel valued, heard.
Yeah.
You tap into their expertise, make the change feel like their success too.
Okay, so the downside of bad communication in QI is huge. Let's flip it. What are the common traps? Where do organizations typically stumble when communicating these changes?
Well, a really common one, highlighted in the QI playbook, is what they call top-down overload.
Top-down overload, meaning?
Meaning communication mostly flows one way, from leadership down.
And the frontline staff feel like they're just being told what to do. No consultation, no input.
Exactly. It feels imposed, not collaborative.
Yeah, I would see that. And another one they mentioned, relying too much on email.
Oh, definitely. That's a classic.
Oh.
Especially in healthcare. You got shift workers, people not glued to a desk.
So crucial updates just get lost in the inbox flood.
Absolutely. Email's useful, sure, but it can't be the only way you share vital info. People will miss things.
Leads to problems. And then there are the dreaded mixed messages.
Oh, yes. The QI playbook really flagged this. Conflicting instructions across different departments.
Total chaos. If teams get different information, how can you possibly have a coordinated effort?
You can't. That lack of a single consistent message just undermines the whole thing.
And another pitfall, silence from leadership when things get tough.
Yeah, during setbacks.
Yeah.
Which, let's be honest, always happen in QI projects.
That's true.
If leaders go quiet then, morale just tanks. Uncertainty, anxiety, it creeps in fast.
It's precisely when things are rocky that you need more clear communication, arguably.
Exactly. And finally, the QI playbook also mentioned poor feedback loops.
Meaning, no way for staff to report back.
Right. Or no clear channels to share how things are actually working on the ground, or if they're hitting roadblocks.
And those issues just fester, unreported, which can seriously derail the whole implementation, especially in a fast-paced place like a hospital.
Definitely. Communication has got to be a two-way street. Okay, so let's shift to something constructive, a framework.
Good idea. The QI playbook talked about the 5 C's, right?
That's the one, the 5 C's of effective implementation communication.
Sounds practical. What's the first C?
First up is clarity. Obvious, maybe, but crucial.
Define it for us in this QI context.
It means clearly defining the what, why, when, how, and who of the initiative. Simple terms.
Avoid the jargon.
Definitely avoid jargon. Speak the audience's language. Clinical terms for clinicians, operational for managers. Yeah.
Tailor the message. Makes sense. Simplicity, transparency.
Exactly. That's key for understanding.
Okay, clarity. What's number 2?
Second C is consistency.
So, sticking to the same message.
Yep. A unified message across all your channels. Email, huddles, posters, training, whatever you use.
Because mixed messages lead to
Mixed results.
Yeah.
And confusion. Total confusion.
Got it. Consistency builds trust, too, I imagine. Third C.
Credibility.
Meaning who delivers the message matters.
Very much so. Messages need to come from trusted sources.
Wait.
Often clinical champions, respected nurse leaders, maybe influential unit heads. They carry more weight.
More weight than, say, a general admin memo.
Often, yes. People listen to peers and leaders they respect within their own circles. Trust is key.
Credibility. Okay, fourth C.
Channels. How you actually get the message out.
And the key here is variety.
Variety is crucial. Use multiple formats. Visual, verbal, written. Reach people how they best receive information.
So examples like town halls.
Town halls for big updates, maybe quick bedside huddles for teams, visual dashboards for progress tracking.
Instant messaging groups like WhatsApp for quick questions.
Exactly. Even storytelling to make it more engaging. Use a mix of channels.
Variety ensures the message actually lands. Makes sense. And the fifth and final C,
Conversation.
making it two-way, not just broadcasting.
Precisely. Actively seek feedback. Encourage questions. Be open to suggestions, even criticisms.
Builds trust, right?
Yeah.
And helps spot problems early.
Absolutely. That open dialogue is crucial for identifying issues before they snowball. Anticipate concerns. Provide forums for discussion.
Okay, the 5 C's. Clarity, consistency, credibility, channels, and conversation. That's a really solid framework.
It really helps structure your thinking.
Can we see it in action? The QI playbook had that mini case study, the ICU bed allocation system.
Yes, a great example. Sunrise Multi-Specialty Hospital. They rolled out a new digital dashboard for ICU beds.
And it didn't go smoothly at first.
Not at all. Initial confusion, resistance.
Yep.
Shift nurses weren't sure how to update it correctly.
Surgical teams maybe weren't trained on using the info.
Exactly. And the IT department was just swamped with support calls. A bit of a mess.
Sounds like it. So how did they fix it using better communication?
They got strategic, implemented a multi-pronged communication plan,
Like what?
brief daily huddles with all the key staff updates, Q&A, clear of confusion,
Okay, direct contact.
visual job aids, simple guides tailored for each specific department's workflow,
Smart. Visuals help.
a dedicated WhatsApp group for real-time support, quick answers,
Instant help. Nice.
and they identified peer champions on each shift, go-to people for colleagues.
Local experts. Love that. And the result of all this?
Pretty dramatic. Usage compliance jumped from about 40% to 95% within just 2 weeks.
Wow. That's impressive. Really shows the power of targeted communication.
It really does. The takeaway was clear. When communication flows, implementation grows.
Nicely put. Okay, let's bring in some more expert perspective. The QI playbook spoke with Mr. Anil Sharma. Lots of experience with QI rollouts.
That's right. He had some fantastic insights.
What was one of his main takeaways on communication?
His big lesson, and it's a quote worth remembering, no one ever complains about receiving too much communication, but everyone invariably suffers from a lack of it.
That really hits home. Err on the side of over-communicating.
Basically, yes.
Yeah.
You rarely get complaints about too much info, but you always hear about too little.
It's so true. How did he approach planning communication before a project launch?
He stressed mapping things out systematically. 3 key things.
Which were?
1, identify all the stakeholders affected. 2, understand their preferred channels and styles.
Right? Tailor it.
And 3, outline the key project milestones and what communication is needed at each stage.
So be really intentional about it.
Very intentional. He gave an example of an antibiotic stewardship program where they had separate, tailored plans for nurses, pharmacists, doctors, even patients. Different needs, different approaches.
That highlights the need for a targeted approach. What did he see as a common mistake organizations make?
A big one is assuming one training session is enough, or like one email blast will do it.
The one-and-done approach.
Exactly. He emphasized that repetition, reinforcement, and having real-time support readily available. That's often essential for people to really grasp and integrate new processes.
Makes sense. Change takes time and support. How did he suggest handling resistance? That's always a factor.
He was a big fan of open Q&A forums, publicly address the fears, the doubts, the frustrations.
Get it out in the open.
Yes. He found that acknowledging concerns publicly really builds trust and can diffuse a lot of the resistance.
That transparency is key. Did he have a favorite communication tool? A go-to?
He did. Surprisingly simple, maybe. Whiteboard dashboards.
Whiteboards in staff lounges and things?
Exactly. Placed in common areas. He loved them because they're visual, dynamic, always visible. A great way to keep key info top of mind, track progress.
Low tech, high impact. I like it. Okay, stepping back again.
Yeah.
What other key communication aspects came up from our various sources, things people should really keep in mind?
Well, a big theme was engaging the human side of change.
Meaning?
Proactively addressing the worries, the questions people have. Using stories, real examples to show the benefits, make it relatable, not just abstract data.
Connect on an emotional level, too.
Yes, and also recognizing and rewarding effort. Acknowledging the hard work people put into adapting that boosts morale, reinforces the commitment.
Absolutely. Celebrating the wins, acknowledging the effort. What else?
Having actual communication expertise on the implementation team was highlighted. Someone who knows how to craft messages, choose channels effectively.
A dedicated communication resource.
Can be a huge asset. Also, empowering employees, making them feel real ownership of the new processes.
And good communication facilitates that feeling of ownership.
Definitely. When people feel informed, valued, integral to the success, they take more ownership.
And it's keeping people updated regularly, right? On progress.
Crucial. Regular updates on progress, being honest about challenges, celebrating the successes along the way. It keeps everyone engaged and motivated throughout. Okay, we've covered a lot. The why, the pitfalls, the 5 C's framework, that case study, expert views, other key bits. Let's try and boil this down. Actionable takeaways for our listeners.
Right. First, big one. Create a communication map. Seriously, map it out.
List stakeholders.
List stakeholders. Figure out their preferred styles and channels, and plan your key messages for each phase, pre-launch, during, post-implementation. Be strategic.
Proactive and targeted. Got it. Second takeaway.
Use storytelling. Don't just throw data at people.
Pair it with real examples.
Pair data with real-world stories. Show the impact. Instead of medication errors reduced by X%, tell an anonymized story of how the change prevented a specific patient issue. Make it memorable, relatable.
Powerful. And the third key takeaway.
Set up a solid feedback loop. Make it easy for people to talk back.
Assign points of contact. Create channels.
Exactly. Clear points of contact in each area, easy ways for staff to ask questions, share problems, suggest improvements. That two-way flow is gold.
Okay, communication map, storytelling, feedback loop. Very actionable. So wrapping this up, it's really clear, isn't it? Communication isn't just like a nice to have in QI.
No, it's fundamental, a strategic driver of success. How you communicate the change is just as critical as the change itself.
Absolutely. Especially if we want safer, more reliable healthcare, which aligns perfectly with the mission of bodies like JCI and NABH, pushing for those high standards of quality and safety.
So as a final thought for you listening, think about your own improvement projects, current or future.
How can you apply these principles? What channels, what strategies would work best in your specific setting?
Maybe dig deeper into some of the resources we mentioned, like the IHI or iSquad websites. They offer a wealth of information.
Definitely worth exploring further. There's always more to learn about doing this well.
Great insights today. Thanks so much for joining us for this deep dive.
My pleasure.
Until our next exploration, remember to keep those lines of communication wide open.